While the winter holiday affords us the opportunity to celebrate togetherness and bounty with family and friends, it's also a time of year that may trigger symptoms of anxiety and depression to different degrees. Joining me today are a panel of professionals with a wealth of background and experience in dealing with just these issues. I'd first like to introduce Dr. Francesca Antonini, who is a clinical psychologist with a private practice in Arlington Center. Welcome, Dr. Antonini.
Thank you, and thank you for having me.
Absolutely, a pleasure. If you would, maybe start us off with a sense of the terrain of the holiday blues.
Okay, well, if you think about the holidays, they're kind of like a time machine in a way. They take us back the same time of year, year after year, through our lives, like little snapshots in succession. So we're all bound to have some feelings during the holidays, either feelings of stress, excitement, anxiety, closeness with others. And all those feelings are normal. They're just kind of a product of the circumstance of going through the same anniversary every year under often different circumstances.
Sure.
This morning, for example, when I woke up and it was December 15th, I said, oh my goodness. I said, Hanukkah's tomorrow, Christmas is next week, and I'm going on TV instead of going shopping? So then I consoled myself with the thought, well, if I were at the mall right now, I wouldn't be shopping. I'd be circling around the parking lot looking for a space. So basically, I went from an anxious mood to a kind of calmer mood. If I had the holiday blues, that anxious mood might be persisting throughout the day. So I like to use the analogy, I like to use a weather analogy. I'm big on metaphors. So for most of us, the holidays are sort of partly cloudy or partly sunny, if you will, where we go from one feeling to another, and most of the time we get through it okay. In the holiday blues, it's like having a cloud cover over you. It's always cloudy. You go about your business, but you can't shake that negative feeling. It may be anxiety, it may be depression, or sadness. But it's there all the time. It slides into depression, and it doesn't, most of the time it doesn't, but if it does, it's like a cloud burst, and you get overwhelmed by those feelings, and they can impair your functioning. And Dr. Ellison is going to cover that. Sometimes it gets as serious as not wanting to, not feeling life is worth living, and certainly at that point, one would need to get some professional help. So the holiday blues I think of as two types. We have the pre-holiday blues, which is all about the preparation before the holidays. We may feel stressed. We may feel sad about people who are no longer with us. We may be comparing our current holiday with holidays of the past. And then there's the post-holiday blues, where you have maybe a feeling of letdown, all the family squabbles that are unresolved, a feeling of fatigue, maybe a feeling of emptiness, an emptiness of the heart, maybe an emptiness of the wallet as well. And also just a general feeling for many people of loneliness. The kids have gone home, the grandchildren have gone home, the house is empty. That's the period where we see more depression, actually. December is a fairly low depression month, but January and the following months until the spring tend to be more high depression months. So I think to illustrate this, maybe it would be helpful for me to talk about a patient I had some years ago who came in feeling really this gloomy feeling around holiday time every year for the past 5 or 6 years. She said it would start right after Thanksgiving and then disappear after New Year's. So I spoke to her for a while, and she told me that she had come from England, and just after she had left for a permanent residence here, a few months later her father died of a massive heart attack. And she had strained relationships with her family after that because they kind of blamed her for his heart attack, and she also blamed herself. So every year at the holidays, she tried to recreate the holidays of her childhood. She missed her family because they weren't in touch. she went through all these elaborate preparations so she could recreate a holiday feeling here, but it wasn't working. But she wasn't quite aware of all these connections. And so in therapy, we talked about how these various issues might be connected for her. And so the following year, she had a better holiday. It wasn't perfect, but through working through some of these things, she actually felt better the following year. We weren't in time for that year. So that was a case where someone was carrying around some issues that surfaced during the holidays. And she was able to work them out, which not only helped her for the holidays, but also for the rest of the year. So I want to say in closing that the holiday blues are very unpleasant, but they can also be, they can also have a silver lining. Because it may be that in tackling an issue that's troubling you during the holidays, you may be working on something that you've been carrying around with you all year long and, again, has surfaced at that time. So when to see a therapist? Again, I think if you're finding that the low mood persists day in, day out, especially after the holidays, or if you're feeling that your functioning is compromised, and certainly if you're feeling pretty down on life in general, it's important to get some professional help.
All right. So it's my sense that it is, if it's the holiday blues, it is something that we can employ some strategies on our own to try and either prevent them from deepening or manage them once we recognize them. Yeah.
Yes.
So I guess that's maybe where we move the discussion from talking about and sort of establishing what it is that we're talking about in the holiday blues to how do we prevent them if we recognize them in ourselves or a loved one? How do we suggest helping manage them if we've already recognized, oh yeah, something's going on here, and I'm under frequent stress, I'm not enjoying the holidays the way I typically do. Where do we go from that? I guess I should say, the person who's going to tell us about that is Catherine McHugh, a licensed school social worker, a mental health and substance abuse counselor, and a registered yoga therapist. What do we do? We recognize this in ourselves, a loved one. How can we help manage that?
Peter, it's really wonderful to be here. Thank you for having the opportunity to
Good
talk
to
about
have
this,
you.
because this happens to so many families. I think particularly my family as well, and everybody's family.
Sure.
The holidays are so filled with so much anticipation, and that's a good thing.
Yeah.
But it also can be a little bit, get us off balance and get us in a place where, where it's worrisome for ourselves and for others. Holidays are always associated with, celebration, and so people sometimes tend to drink too much or be with, be out too much, sleep, or don't sleep. We have a New Year's holiday that anticipates us being up all overnight, and that can really exacerbate some of the symptoms that might come with what is called holiday blues. But then you were talking, Dr. Antonini, as well, that we have so many associations from childhood and before. So there's a lot of things we can do. One is all around, going to the mall and shopping. Online shopping is an opportunity of a possible solution. If you do know that you're subject to the possibility, there's options. You don't really have to go to the mall at this point. And in fact, it might be not a good idea to go to the mall at this point because we're so close now to the holidays. Another thing is to think about, so often in the preparation for the holidays, many people think it has to all be perfect. So they have that one thing in the closet up in their they have to get it because that one piece has to be outside. Well, maybe this year you take a breath. And rather than having to go all the way up to the attic and go way in there and crawl, maybe this year you're just going to leave it where it is, especially if you're feeling, or if there's a feeling of, sense of off balance through the holidays. Another way to self-care is if you were talking about families and families coming together. Well, if you're going to see your family, maybe limit the exposure and how much you're going to be there, especially if you're going and the family's going to be, maybe celebrating a little bit more than you think is going to be good for you. So you could stay at a hotel or, and all through this, I like to think about some of the things that are at risk. So you're at risk possibly for off balance or getting ill. So how would we manage well-being? You know, some of the things we manage is our nutrition. So perhaps if you're going to go to a holiday, before you go to a holiday, get a little snack. So then when you're exposed to the things like the cookies and the extra, you know, offerings that happen at these holiday parties, and perhaps, you know, maybe if there's someone that will be overtaking, maybe you be the designated driver so you can drive everybody home. Other areas include family. Well, how much is too much? And if that's true, well then, one way to really manage that is get yourself a team outside of the family, so for support. So if you are going to visit family or you're having family come to you, get yourself a group of friends or colleagues that you could call and reach out to. One of the ways people get exposed, like you were saying, is that pre or post. Well, so one of the ways to manage that is perhaps have some balance in between. Another strategy is exercise. Exercise is a wonderful way. Go out for, during the midst of the holidays, go out for a walk. I happen to live, you know, by the lake over in Arlington, or you know, go and look at the stars and take some time for you, in preparation for you. And then restorative sleep. How important it is, especially during the holidays, to increase some of the strategies for preventing, so that while you're going through the holidays, it's a little bit more manageable. So real good self-care skills can help to make this whole process. The biggest thing is, one way that it gets kind of tipped off balance is the whole idea of having to spend money. So perhaps you can do something in your family like Kris Kringle, where rather than buying everybody presents, you set up a situation where each person gets one thing and it's something of meaning to connect you, but you don't get overwhelmed. Or even better, volunteer. Go to a soup kitchen and deliver services at a soup kitchen as a family, and then you know you're going to get yourself out of yourself. And that really helps people. The blues is a thinking, and one way to support the shift of that is to get involved in something outside yourself, which can really help move through this holiday period, and perhaps look back at fond memories in a different way. So you can create new strategies.
Well, it sounds like really all of your input is know thyself. Know what triggers are, and also being honest about that, plan ahead so that you limit your exposure to those things that you know are triggers, in fact.
Exactly, and one other way is like, we all have one. I know my family has one. I love her. She's amazing, and I always loved going to her house for the holidays, but she cooks, she does everything. One way to manage that is ask for help, is have, you know, Aunt Sue bring the pie, and Uncle Joe bring the libations, and maybe someone bring the rolls, and that can help to really manage some of the stress of having to have it so wonderful and perfect just the right way. It can really be very helpful.
And to the point that Dr. Antononi suggested in the illustration she brought up, of somebody sort of trying to relive a past experience associated with the holidays. It's a matter of perhaps establishing new routines. Let's start this over and create a new tradition.
There's actual proof about that in the brain, that we can rewire the brain and make new pathways to those neural processes. And this is one way you could do it, is create new habits.
Sure. Very good. Thanks very much.
Well, thank you for having us.
Absolutely. So we go from talking about what the holiday blues is to how we might prevent and or manage it, given a recognition of it. And then it's really to a point of recognizing maybe when the circumstance has gone beyond the holiday blues. Sobering statistics conclude that stress-related events such as the holidays may trigger half of all depressive episodes, which begs the question, when might the holiday blues not actually be the holiday blues, but something deeper? To help us discuss this is Dr. James Ellison. Since 1999, he's worked with the geriatric psychiatry program at McLean Hospital, of which he is now a director. How do we recognize when we've crossed a boundary, if you will, and when either ourselves, if we're fortunate enough to have that sense of self, or we see our loved ones needing some help that maybe we need to seek outside help for? How do we make that transition?
Well, thank you, Peter, for asking me.
Absolutely.
And I'd like to talk about that boundary between holiday blues and what we'd call major depressive disorder, the disease of depression. When we use the word depression, we can mean all sorts of things, from colloquially just saying that we're having a bad day or something's disappointed us. But there's a degree of depression which involves the mind, the emotions, physical functioning that goes beyond into a disease state. And as you said, the stress of the holiday is one of the things that can trigger a depressive episode. But the boundary between holiday blues and major depression is really a very fuzzy one. And you can slip over it without really recognizing that. So one of the things that we can do during the holidays is keep an eye on the people that we love and that we mingle with, and watch out for them a little bit in case anybody is slipping into that state of depression. Depression is very common. In the latest statistics, more than 7% of the population suffer from a major depressive disorder, and more than 3% suffer from depression which is very severe. And yet it's only about a third of people with major depression who seek help from a mental health professional. And the other 2/3 are suffering, and they're not getting the kind of help that they need, or some of them get help in other ways, of course, turning to friends, turning to their primary care doctor, just reading or meditating, or many other things. I don't want to imply that the only way to get help for depression is from a mental health professional. But there is a stage of depression where that's important. In the holiday blues, a person feels down, they feel sad, they don't enjoy things as much as they expect to. But in depression, the emotions of depression take on an additional quality. And the key feature of that is what's called anhedonia, or the loss of enjoyment. When things that used to excite or cause enthusiasm just are not enjoyable at all, that's anhedonia. And it's often associated with depressive thoughts, feelings of not being good enough, feelings of being unable to make things better, and the doubt that things will ever get better. A person with holiday blues might say to themselves, once the new year rolls around, I'll probably feel better. Or once I get home from a family visit where there's a lot of tension, I won't have to worry about this. And mixed in with the tension, of course, there's enjoyment of being with the family. But in depression, that goes away. There also are cognitive symptoms that go along with depression. And these include difficulty concentrating, difficulty paying attention, difficulty making decisions. And these accompany the self-doubts and the feelings of failure. And then there are physical symptoms, fatigue and difficulty sleeping. Everybody has an occasional sleepless night, but in the disease of depression, typically what happens is a person gets into bed, they're tired, they want to sleep, they fall asleep, and then after an hour or two, suddenly they're awake, they're lying in bed worrying, they're feeling terrible. There may not be anybody to talk to at that hour, and they lie there feeling, miserable and anxious. That's the sleep disturbance. It's called early morning awakening or intermittent insomnia. In addition, physical symptoms of depression include fatigue and loss of appetite, or in some cases, increased appetite. So these are characteristics that really are different from holiday blues.
Sure.
Yeah.
So it sounds like it's a function largely not only of quantity, of, if you will, more and more days pile up.
Yes.
That on balance, I just didn't feel myself. as well as quality. That is to say, a sense of unease that is deeper than what would be associated with the holiday blues in sort of a classic form, I guess.
Yeah, what you're saying is exactly on target.
All right.
So it's not just that there's more feelings of depression or doubt or sadness or feeling low, but it's persistent.
Okay.
And the character is different because in depression, a person doubts themselves. They may lose the pleasure that others would feel at some parts of the holiday. Sure. And they may even lose the pleasure, like Dr. Antonini was saying, of being alive and think that they've lived too long or that life is not worth living.
Yeah, it does seem to me, and maybe this is a time when we can just sort of open up the floor to each other, and either raise questions or share comments, insights perhaps. It seems to me then that boundary really is quite fuzzy, though, yes, and it takes a sharp eye to discern what is holiday blues, what is something that I need to pay more attention to. You said, the holiday blues can start in the run-up to December, November maybe, and then last as long as into the spring. So, I mean, we're talking roughly, conceivably, a 4-month, 5-month period of one's life where, out of a 12-month span, if it's something that recurs.
Actually, I think it's the blues is pretty much more time limited,
Okay.
the holiday blues.
Okay.
If it does run into the spring, it might be depression because
Okay.
of the length of time.
Okay.
Yeah.
And there's another particular flavor of depression called seasonal affective disorder or seasonal mood disorder, which has some elements of both. The person's mood may fluctuate more. They can have good days and bad days.
Yeah.
There can be a lot more anxiety. Instead of having trouble sleeping, the person with seasonal affective disorder tends to want to hibernate more and sleep more. And they tend to eat more rather than eating less. And this type of depression usually has its onset as the days start to get noticeably shorter and the darkness comes earlier.
As we have in New England now.
We do that.
We're
We do
moving
that.
towards the shortest day of the year.
That's right. Coming up in just a week. So there is hope in that respect. Anything else that you can think of that would be useful conceivably to viewers?
But one of the ideas of that, the seasonal, with the holiday blues or the seasonal affective, is that the days do get shorter and it does get darker. So one of the things to counter that is to get outside while it's light, or there's sun lamps. There's certain strategies you could use and adopt in your lifestyle and bring them into your home. So to set yourself up, if you are inside, to make it so it's better for you, so you might not succumb to, the difference between the blues and moving towards something more deep.
I think that's right. And you were also saying before about exercise, getting out and taking a walk, and in general, forms of exercise that are aerobic help the mood a great deal. And they can be as effective as an antidepressant for some people. But maybe we should say just a word about antidepressants and psychotherapy too, because as Dr. Antonini was saying, if a person's low mood persists, then we might want to get a referral to a psychotherapist and talk about expectations and hopes that were not met in the holidays, or if a person's anhedonia is severe, if they start to have feelings of wanting to harm themselves or doubts that they'll ever get better, an antidepressant might be of value.
Might it make sense, doctors, for people who are facing increased stress to make more appointments during the holiday time?
You mean more appointments to be around other people more?
To be around more other people, or to come to see their primary therapist or whoever they come to see while during the holidays,
Somebody
to kind
who's
of
already
boost
in
them
therapy.
up. Right, someone that's already in therapy.
Makes sense. I think one thing that is maybe an easier sign for people regarding whether their blues is moving into depression is what I tend to deal with in therapy, the behavioral aspect. How well are they functioning behaviorally? if they feel that their feelings are so strong that they can't get themselves out of the house, or they can't get to work, or they're always late, or they're just not feeling, they're unmotivated to do anything, and that's actually happening, that they're not doing what they want to do. I think that that's certainly a sign that something's happening beyond just having a bluesy feeling. So I think that, you know, in those cases, sometimes loved ones notice it before the actual person notices it.
Well, and I think that's a good point. I think we've spoken very much about you know, how we might recognize it in ourselves, and I think it's probably much more likely, is it not, that a loved one close to us will recognize it maybe before we do. That is to say that our behavior is a little bit out of step with what is typical. Artful ways of making this observation with a loved one, suggestions?
Well, I think inviting the person to talk as a first step, to say something like, gee, you know, you seem something seems a little different. Is everything okay? Just to check in, I think initially might be a good way to approach it in a way that doesn't feel challenging or overly negative.
That makes a lot of sense to me. I think to avoid making some kind of a big global pronouncement about somebody's state of mind, and just to say, you seem to be having a difficult day. Do you want to talk? Yeah.
Or even is anything up? Very non-threatening, very supportive, very compassionate. I would go so much to say, though, too, is there's actions you could do. Let's go for a walk. You know, let's go out and do something different today. Changing up the routine, changing up the anxiety and stress, and creating really practical ways of managing the holidays as a group, especially if you're noticing, you know, your loved one or someone you care for, can be actually very helpful without being threatening. And it also, if you create the space, there might be the opportunity that they talk to you. You don't necessarily have to create it for them. You know, there's ways you can be pretty creative about that.
I think one of the challenges in depression, not so much the blues, is that people are no longer motivated to do very much at all. So sometimes a loved one trying to get them to take a walk or do something, they just can't. So at that point, I think it might make sense to gently suggest that maybe they need some help from an outside professional.
Very good. And certainly if there's somebody who knows therapists, professionals in their community, all the better in terms of helping cut down the number of steps that somebody might need to take to get help for themselves. Yeah.
Another really key thing is nutrition, because the nutrition is definitely going to affect, you know, how we feel and how we feel in our bodies, how we think, and what we know. So really paying attention to what we're eating and how we're eating and when we're eating is pretty important during the holidays.
True.
It's so easy to overeat in the holidays and put on a few pounds and eat things that you don't usually eat. So any advice about how to avoid that?
Well, portions.
Yeah.
You know, if we think about our stomachs, it's not much bigger than this. And also selecting very nutritious foods and less of the sweets. Try to limit the alcohol and exposure to alcohol. That's going to definitely, alcohol is a depressant. So if add to maybe the holiday blues alcohol, then you're prone for disaster. You know, so how you manage that, and portions, and eating less and maybe eating a little bit more often can be really helpful.
Very good. We are fortunate enough to have a studio audience with us today, and I think there's a question. Please.
I was wondering if we could hear some suggestions for families who have experienced the loss of a loved one during the year. You're feeling sad already, but then the holiday time comes, and it seems like a particularly difficult time. But what suggestions are there for families who are in that situation?
Great, thank you.
Well, I can.
Sure.
I have a comment, and it's a challenging issue that I often go over with my older adult patients, and that is who've lost spouses, which is a very common, as we know, loss in older age. But at the holidays, it just becomes devastating for them. To talk about their spouse You know, what happens in a family at holiday time often is there's this collusion of silence where the communication about the lost person, with all good intentions, diminishes because people don't want to upset each other. When in fact, the bereaved person, the widow or the widower, is aching to talk about the lost person. But the children don't want to bring it up because they're afraid they'll upset mom. So somehow finding a way of broaching, of bringing up the departed person in a non-threatening way and kind of feeling the waters. You know, if people respond, keep talking, because communication, bringing the person into the room who's passed on, can be very healing.
The Dia de los Muertos. Let's address this as opposed to skirt around it.
Yes.
And it's especially painful and difficult during the first holiday season after the loss. The psychiatric classification system for diagnoses took an interesting step forward this past year when they decided that a person in bereavement can also have depression. Before that, there'd been a lot of controversy about whether it makes sense to diagnose a depressive disorder in somebody who's had a loss. And now it's recognized and accepted that the symptoms of depression can be seen along with the symptoms of bereavement and should be treated as such instead of taken just as bereavement.
Such a welcome change.
Yeah.
Interesting. Is this also...
And again, perhaps support around the bereavement through seeking help, seeking counsel or a group or different ways that folks could go and get connected during the holidays while they're connecting with that loss, I think is an important thing to have them have access to, and those groups exist. So connecting with that as well as bringing it up in the family, and you know, there is a place and time always to mourn. And it would make sense to have or create the space and the room with those that you love to really do that. Maybe have another, maybe slight memorial or some kind of acknowledgement of the person that's gone in the living, and really recognize that that's how we move on.
I think in the Jewish religion they have a wonderful ceremony a year later called the unveiling, which allows people to mourn their loved one around the anniversary time. And people have told me how healing that is.
I would imagine.
It is, and every year on the anniversary of the death, a candle is lit. Yeah.
Would this also be an opportunity where we sort of think about establishing new routines? That, you know, when we all were together, we did certain things. And obviously, to address the loss is one step. And yet, you know, when we get together in subsequent years, we may be trying to do those same things that we did with a radically different group, given the loss of a member of it. Is this a point where maybe we establish a new routine so that we can?
I kind of put together a little piece just in preparation where it really addresses that sort of leaning on solid support system. You know, so. Bringing in the forces during the holidays that would support you to get through in a way that is more effective than the pressures of having to, you know, be perfect. Shaking up the holiday routine, like maybe go to a movie on Christmas or a New Year's walk or volunteer at a soup kitchen. That's the kind of idea. Bring your expectations, make them clear, but make them gentle and modest over the holidays. Don't sweat the small stuff. And everything's small stuff.
Sure.
It's actually not, but you know what I mean by that. The more we don't get so boggled down by the stressors over the holidays about shopping and showing up and getting there and all that, the less likely that stress, if it's just holiday blues, certainly not depression, you're likely to tip over and say the wrong thing at the wrong time to, you know, your loved ones. And strive for just a little better than last year. Every year. And what I meant by that is that expect good things to unfold. You know, so much of how we anticipate that here comes Christmas and oh my gosh, I'm gonna have to be with those people. You know, the more we can bring a positive frame to it and think of, you know, this year maybe I'll do just this piece a little bit better. And finally, eat well, exercise, and limit the extras. and get plenty of rest. Just a
Very
little
good.
bit of a routine.
Yeah, yeah. Any other questions from the audience or from that we maybe have for one another? There is.
I understand the idea of coming up with new traditions and self-care, but wondering if there's any suggestions on how to talk to family members about that. Maybe I'm an older person, I want to change the routine. I don't want to do all the cooking this year, or I really don't feel like being out Christmas Eve and then at 7 o'clock. Anyways, any of those kind of changes. But how do you talk to family about making those things happen and dealing with their disappointments or expectations or what they think I should do or those kinds of things? So how do we talk to family about those things?
I mean, certainly we come with families. There are varying degrees of openness and willingness to engage in this kind of dialogue. How do we make those inroads?
Well, one of the common situations is where parents are getting older and, for example, a matriarch of the family who's always prepared the family celebration with very little help is finding it more of a burden. And that's a situation where the children, the siblings, can talk together and decide among themselves what they can do to lighten the load and how they can make things easier for their mother.
Sure.
Yeah.
And also the older person who's having trouble actually saying what she needs to her family. And I like your point about different ways of conveying what one needs, different styles, but encouraging that person to communicate what they need to their family. Gee, you know, I'd like to do a little less than this year. I need some help. Could someone bring the pie? Could someone bring the turkey? So often that's some of the work I do in my work with patients is to try to get them to, first of all, be aware of what they need, because sometimes they don't even know that they need to do less, and then how to convey it.
And that's really hard work, isn't it? I mean, it's no small order in the sense that I can imagine with a matriarch who's feeling tested by what she's typically done. Maybe, you know, if I admit that this is something that is taxing me now to a degree that I simply can't carry continually. You know, we have to recognize the downside of our lives, yes? Both as those adults, as well as the children of aging parents, in this case. You know, and recognizing what our limits are, what can we do and what we can't do. It requires...
But also acknowledging that it's true, if there was a matriarch, acknowledging that, you know, that potential and that all the things that they gave, all the gifts that they could. It's a really, really good question.
Mm-hmm.
You know, sometimes
Absolutely.
one-on-one is the way to go. Sometimes maybe 2 and 2 is the way to go. It's a very good question because every family has a different dynamic. And so coming and engaging in small steps, in other words, one step at a time. Maybe it's a conversation one-on-one where you bring someone to tea, and then perhaps there's a conversation that can continue from that might bring in a little bit more of the family. Or in terms of, you know, the person who always has made, maybe it's just, okay, this year I'll just bring this. And the following year it's a little bit more. And strategically working with them where they will be willing to give a little and then you can get a little. You know, working in small and incremental steps generally rather than overwhelming or you know, sometimes in the attempts to really be loving and to support the family, it's too much, and then you get back. So it's a very fine balance about working with your siblings and your parents and even extended family about making and managing some, especially if you see depression. So keeping it simple but keeping it real and direct is very important, and in a loving and kind and gentle way.
I like your point about the grieving, though, that might be necessary regarding the loss of abilities as you get older, certain abilities. And so in therapy, with older adults, that's often a focus. You know, how to adjust to the limitations of aging is really a big issue.
And along with that, loss of control and loss of status.
Loss of the
and-
car keys.
Yeah, all of
You know,
those.
all of those. And no, really, it,
Yeah.
it
These are
can be
difficult
very
changes.
depressing for
Yeah.
them.
Anything else along the lines of red flags that we should look for? Either thinking holiday blues or something more significant in terms of depression. Anything that we should keep our eyes open for, I guess in this case, probably particularly loved ones.
Isolation, significant weight increase or decrease.
I would say any major change in behavior, and that's changes like that are often much more apparent to a loved one than they are to the person.
Right.
I think that can often be a sign either of depression or some other disorder, possibly.
Yeah. And it's a time when excessive drinking might signal a problem as well.
Very good. He took the words out of you. Anything else that you think might be good for viewers to hear on the topic?
Well, I think one important
hold on
thing
a
to
sec.
say. Yeah.
I'm sorry, go
Yeah.
ahead, and then we have an audience member to
Oh, good.
ask.
Yeah, one important thing to say might be to emphasize that among the various kinds of problems that a person can develop, depression is one of the most treatable, and that there are excellent resources,
Great.
Peer group support, wonderful books that can help people, and therapists and medications available to be of great help. Yeah.
Very good.
Yeah.
Question?
Yeah, okay, if you see somebody, a family member, and you think that they've got a problem, what shouldn't you do?
Well, I think you don't want to challenge them in a way that feels threatening, like, what's the matter with you? Why are you doing this? But to be gentle and to ask them, as we said earlier, is anything wrong? You seem a little different. But you don't want to hit them over the head with what they're manifesting. People, especially older people, have a real feeling of stigma about depression. It goes back to the days when we didn't understand that it was a physical as well as a mental illness, and people still see it as a sign of weakness rather than as a sign of illness. So I think just helping someone talk about how they feel without necessarily challenging or labeling it might be a good start.
Yeah, these are very good points. Did
I
you
would
want to
say
say
it's what you
something?
don't do is nothing. So especially with loved ones, we all, as we relate to our those that we love that are nearest and dearest, I think that's the place of the most challenge. That's where we show our greatest imperfections and we do the best we can. But to do nothing, well, that actually exacerbates some of the symptoms of depression, and isolation is one of those symptoms. And also sort of modeling supportive and caring and healthy ways of life is a good way to manage it. But to do nothing could really end up disastrous. And there's help available. So, there's hope for folks who are family members of folks who have mental illness. And that's another way to be involved yourself so that you carry and maintain a really good boundary around how you talk to or don't talk to individuals, and maintaining the integrity and dignity of your own caring about that is as important, because we can get just as sick caring for people as we can in a major illness ourselves.
And just to push this one step further, sometimes a person who's feeling low will reach out, and meaning well, people who care about the person might make little of their concerns. It's not that bad. Everything will be okay. And it's important not to invalidate or turn aside a request for help. Sometimes the result of that can be that somebody feels more isolated and more hopeless.
Right. So in the midst of the busy holidays, trying to make the moment, the extra moment or two
Yes.
that are required to make that acknowledgement and engage with that question or that statement. Yeah.
Really well said, Peter.
Yeah. Okay. Anything else that bears saying? Thanks to our studio audience. And thanks very much to you, to each of you. Wonderful contributions, all.
Thank you
Thank
for
you.
having
Sure.
us.
Thank you for having us,
Absolutely.
Peter. Happy holidays.
Thank you. You too. The holidays, of course, were born of our human need to connect with something larger and deeper than ourselves. And while it may seem like wishful thinking to imagine a holiday season before Black Fridays and the latest gadgets, long flights and economic recessions, we hope it is completely realistic that today's conversation at least provides some guidance to reclaiming our holidays. On behalf of Francesca Antonini, Catherine McHugh, and James Ellison, I'm Peter Bermudez, wishing you a happy, healthy, and low-stress holidays.